everyone, welcome to The Social Doctor, and this is Dr. Ayushi. The Social Doctor is a platform for the doctors by the doctors, where we discuss journeys, experiences, and knowledge from successful medical practitioners. And today we have Dr. Sandeep Khasa with us. He is a practicing cardiologist in Gurgaon, and in his years of experience, he has understood the pros, cons, the advantages, the kinds of lifestyle in different kinds of job opportunities. And so he's here to help us understand what are the advantages and some challenges that are attached to different kinds of job opportunities, as well as he will also tell us some of the alternative career opportunities that a doctor can go for after his graduation or post graduation. Welcome, doctor, to the platform. It's really nice to have you here.
Thank you very much, Aishu, for providing me a platform to discuss all these things.
Yes,
And
yes.
we can start our program.
So, doctor, let's start with a brief about your journey. How has it, gone forward, and how has it evolved till now?
So for me, it's fine. I started in 2000 with my MBBS, which was completed in 2006. 7, I got admission in MD medicine, and in 12, I got admission in DM cardiology. I've been practicing in private sector from 2015 till now, and it has been a nice journey.
I'm sure. I'm completely, I completely agree. So now when you have experienced in these years, the kind of the setup in private, in your journey, what have you felt, what a doctor should understand after the graduation or post graduation before going for any job? What is the kind of mindset? How should a person select the kind of job a person should go for? What do you think around that?
First of all, after completing your graduation, you have so many subjects to choose from. First of all, you should decide where I'm going to practice, in India or abroad. Some people goes for USMLEs or PLABs and all these things. So that is the best time to go off. Many of my colleagues, after doing post graduations, they start thinking about USMLE. But when you just go over there, again you have to do your post graduation from step one. So your 4 year, 3, 4 years, 5 years are wasted. So it's always best to decide after graduation whether you want to practice in India or abroad. First thing is this. Second thing is which field you are going to practice. Fine. Then it has to be decided by you, what you want to pursue in your life. Even though in many cases, whatever we got, whatever streams we get, people goes for them because just because of competition. Some 50% of us are not able to get what we wanted initially. But it's always better to wait for a year to do more studies and to wait for a year if they want a field of their own choice. There is no harm in this because life is too long. Waiting for a year will not harm you. But if you have taken a stream which you don't want to practice, it's going to be with you for whole of your life. It's always better to wait for a year or two to get the subject in which you want to practice. That is
Correct,
the most important, two important things which
correct,
one should
correct,
decide
correct,
after doing his or her graduation. That is
correct,
the thing.
correct. And glad to know both of these points. You are correctly said. These 2 points are very important, to go forward. So now, if a person passes out from his graduation or post graduation, what are the kind of job opportunities a person are are available for the doctor himself?
Actually, after doing graduations, you basically have two kind of jobs with you. First, you can go for government jobs, which can continue for your whole life. And if one doesn't want to go for post graduation, that is the best time to get in the government jobs. If you join any medical services, your seniority is always decided by the year when you join. Your degrees doesn't matter. Whether you are postgraduate or a super specialist, you will be a senior person if you are joined earlier. So if you are willing to join medical services of any state or any government, it's better to go very early. so that you can be a senior person. Second type of jobs which are available for a graduate are basically JRs, junior residents. JRship is not something you will carry on forward for your whole life. It's basically a short-term job which you do. So if you want to go for your exams for post-graduation, all these things, it's always better to do either just sit at home and go with your studies, or you can do a JRship for 3 4 months so that you can be financially strong,
Hmm.
and then just leave them. Otherwise, doing both, putting both your legs in the boat, it's difficult.
Hmm.
Now you are doing job on one side and you are preparing for your exam on other side. Chances of getting success, they diminish. So it's always better to go with a single goal. Initially for 2 3 months, because it's a long time. It's a 12-month period over which you studies. For 2 3 months, you
Correct.
can go for a job or so. Otherwise, after that, you should quit it.
Correct. That's true. And what about post graduation? What is your suggestion after post graduation? These are some fantastic points for the undergraduates who have just passed out. But what about the postgraduates, the MD, people? What are the kind of job opportunities for them?
Now, different fields are there. Some fields have super specializations.
Correct.
Like MD medicine have super specialization, MS surgeries have super
Correct.
specializations,
Correct.
and radiology has got super specializations.
Correct.
In others, you can go for some fellowships if you want to be
Correct.
good in anything. I think for us, if you want to learn something new, the best thing is to complete your studies before entering any field.
Okay.
First of all, if you want to, let us take orthopedic surgeons, there are no super specialists. But if they want to specialize in some sports injuries, or they want to specialize in some transplants, knee transplants, hip transplants, it's better they do some fellowship in those, and then go ahead with their journeys, with their careers. It's always
Correct.
better because learning is a whole life process. That is other thing. But whatever you want to do, you should complete it before entering the field. And
Correct.
second, there are two options with people. First of all, what I will recommend that one should always do a SRship,
Okay.
and
Okay.
that usually he should not do from his parent college. That's what I think.
Hmm.
Because what if you have not learned in last 3 years? I don't think you are going to learn something new from there, because
Yes.
you are there in there over last 3 years. You are not going to get something new.
Hmm. Hmm.
Unless is a hands-on practice, like for a surgeon, if he is not getting enough surgeries and he thinks that he will get more surgeries over
Hmm.
there,
Hmm.
then he can practice over there for some time. And after passing post graduation, at least for a year, you should do a senior residency
Hmm.
with whomever you want to do it,
Hmm.
so that you can gain an experience.
Hmm.
Because and whenever you enter private practice, it's always
Hmm.
better to do private practice for 6 to 8 months below somebody, because
Okay.
it's not like doing practice in a government institute and doing practice in a private setup are two different soups. They are
Correct.
not similar. In
Correct.
private practice, you are answerable for many things,
Yes.
and it doesn't goes as you are practicing in government jobs. So one should always go for some experience over there.
Hmm.
And if you want to go for super specialization, again it's a similar thing. Just do your SRC for 2 to 3 months and then just go for your studies, because finally you are going to practice your super specialization. There is no point doing SRships in medicine or surgeries for a long time. You
Hmm.
should
Hmm.
prepare and you should enter it as soon as possible so that you
Hmm.
don't waste your much time. It's better after doing super specialization, go for SRship and learn that. If you want to learn more, learn those things while doing super specialization, because super
Hmm.
specialization is something which
Hmm.
is restricted thing.
Hmm.
Now,
Correct.
if you talk about medicine, so a medicine person is going to see many things.
Hmm.
You will see
Correct.
each and every field. But
Correct.
once you become super specialized, you should be seeing only your field, and you should always know that you will be doing quality work, but you will never have quantity.
Correct. Correct.
Quantity. So one has to decide whether I want to see 100 patients or I want to see 10 patients. It's individual preference.
Correct. 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 That's actually very important to understand. So now, if we have already discussed the kind of opportunities after for the undergraduates as well as the postgraduates, so now let's discuss about each opportunity in a bit depth. So if a person wants to go for a government job, what are the kind of government jobs that are available, and what is the kind of pros and cons attached to each one of them?
Basically, there are two type of government jobs available. One is in medical fields which are run by governments like Delhi State, Haryana State, Punjab State.
Correct. Correct.
These are one kind of jobs. These are just like you are a medical officer, then you will get elevated to a senior medical officer, then you will become chief medical officer.
Yes.
These are different kind of jobs. And second jobs are which we do in medical colleges.
Hmm.
Now, if you enter the services, government services, they are more oriented towards programs of government.
Okay.
There are many health programs which are running, and you have to run all of them.
Hmm.
So, patient interaction and doctor interactions and treatment part is not that much in that jobs. Even though you see patients, that's okay, but most of your time is consumed by these programs.
Okay. Hmm.
Day 3 4 hours you can see OPDs and do all the things, but these programs are run and you are a supervisor for all of them, and it's a
Hmm.
community based program which government run.
Hmm.
So you have to do those works as well. So it's a
Hmm.
different kind of job. So who
Hmm.
doesn't want to be a part and parcel of those should not enter those fields.
Hmm.
And government jobs available are in our medical colleges. And in medical colleges, everybody has seen what assistant professor do or associate professor do. They are more academic jobs,
Hmm.
and you can learn more. You can be academically more strong.
Hmm.
And if that is another kind of job that are present in government
Hmm.
services.
Hmm. Hmm. Hmm.
Uh, I think these are the two job
Hmm.
opportunities we
Hmm.
are
Hmm.
talking
Hmm.
about.
Correct.
Other
And what
things
is
are you can change your stream and you can go for IS, you can go for MBS. That are other things you can do, but it's on you only.
but with the to practice medicine, these are the two kind of opportunities for the doctors in government. So what are the kind of lifestyle that is attached with a state government job and a medical college job, as well as pay scale? Pay scale is something which is questioned always.
Pay scale is good enough nowadays, not bad ones as you is used to be after this sixth pay commission. Pay
Hmm.
scales are not that bad, even though everybody is getting a decent income. That is not a thing. And
Hmm.
lifestyle is dependent upon you. It's not dependent upon your job.
Okay.
Even
Okay.
though I tell you in government jobs you will get more time.
Okay.
It's a fixed sort
Time
of
zone.
time
Hmm.
time time part job. In
Hmm.
private practice, usually people doesn't get much time. So
Correct. Correct. Correct.
lifestyle is something different. Basically, workspace you can say they are not as neat and clean as they are in private practice. But
Hmm.
private practice, even if you are working in small setups, they are similar to government setups only.
Correct. Correct.
So that is the thing.
Correct. Correct. Correct.
Lifestyle
So
is
at yes. Sorry, please continue. Yes.
no. Now your turn.
Acha. Okay. So now when it comes to the private jobs, what are the kind of private jobs that are available, and subsequently, the lifestyle and pros and cons of the same.
There are two type of private setup is again of two types. One is totally corporates. Another is that is run by individual doctors.
Hmm.
The private corporate jobs are you say what you said lifestyle. So when you enter a corporate job in a big hospital, you are fascinated by that. Oh,
Correct. Correct. Correct.
but the thing is incomes are not that handsome in those initially if
Correct.
a person is entering, but
Correct.
they are very good learning places for at least for 1 or 2 years. What is
Correct.
happening inside them, you will never be able to know what's happening inside them if you don't enter them. It's a different level of things they go through. goes over there and how things are carried by corporates. So it's always good if you have done a super specialization, go in them, spend a year over there, and you will know things are wrong. That can even help you in running your own setups, you know,
Okay. Okay.
because as during our studies, we are never told how to run setups and how to do all these things.
Correct.
We only know
Correct.
one thing, how to treat a patient. But
Correct.
treating a
Correct.
patient and running your own this clinics and all these things, these are different works.
Correct.
Secondly, the in the private sector there are individual hospitals which are
Hmm.
run by people.
Hmm.
Uh, they are run with cost restraint as they are providing good services at a lower cost.
Hmm.
Uh, they are also a nice place to work at, not a issues.
Hmm.
If you are living in a tier two cities, most of the
Hmm.
hospitals you will get will be these kind of hospitals. And
Yes. Hmm.
the newest thing which is coming in the tier two cities are some doctors, they are forming groups within
Hmm.
them and they
Hmm.
have started the hospitals. That
Hmm.
is the best thing happening.
Hmm. Hmm.
Actually, 4 or 5 doctors of different branches come over together and they start up a setup.
Hmm.
So you can provide many things at under a one roof,
Hmm.
and the cost is shared by many people,
Hmm.
and you even get more patients and more this because you are giving everything under one roof. I
Correct.
think there is a good uh, future for these kind of setups.
Correct.
If as the cost is very high of building any infrastructure, the machines and all those are not that costly. If you go nowadays, the
Hmm.
infrastructure and the land thing and all these, you have to take many government what you say them
Ye-
assurances or
hmm.
clearances. It
Yes. Yes.
takes a lot of time. So if you 4 or 5 people come together, you can set up a good base and you can start.
Hmm.
Previously it was all about these things. All
Hmm.
the things were done by a single doctor, and single it's become very difficult because
Correct.
everybody now needs some time for themselves. It's
Correct.
always good to form a cohort and start something new. That is another good thing.
Yeah.
Or the last thing is, if somebody is running a big hospital, just join it and you can enjoy your life.
Correct. Correct. Correct.
You can go and
Completely agreed. Yes. 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 And actually, the thing you just mentioned, that two, three doctors coming together, that actually helps you to build a good quality and a practice and a good facility practice like the corporates are actually doing these days. So maybe that is the reason this kind of practices are coming up. Perfectly agreed. So now, because you have been working into corporate, so if you can give an insight, what is the kind of lifestyle that you have been, you know, leading in these years when working in corporate, and what are the challenges that you have faced in this?
actually in corporate, if they are big corporates, you need 4 or 5 years at least after passing out to have a name of yourself,
Correct.
because there are so many big people working over there. Nobody is going to ask you what you are doing. You are just working under him.
Yes.
You have to be patient. And secondly, you have to look for opportunities. Whenever you are going to get an opportunity, you have to switch. If you don't switch, then you will never grow.
Okay.
This is a thing. If you don't switch, you will never get a good growth. So
Mm.
don't switch every 6 months. It will
Mm.
hamper your career.
Mm.
But whenever you get a good opportunity after 2 years, 3 years, or a year, you
Mm.
should switch if it is compatible with you. So,
Mm.
and secondly, the corporates are now entering tier two cities. There you can go as head of departments. Even they are run by single person
Mm.
from the specialty. There you can move on, and there are also good opportunities which you can access. That is the thing. But you should remember that it's just like running your own clinic. Then you will be alone, and you have to do everything. But still, the stress over there is less than the corporates in the big cities.
Correct. 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 So now, when mentioning about tier two, tier three cities and the metros, what do you think? If how can a person decide where to settle down? And is it that settling down in tier two, tier three cities is monetarily better, or it's not that way? Or metros are better monetarily? How does it go?
The thing is, if you are super specialist or a specialist, you will get more pay over tier 2 cities.
Okay.
And second thing which I have seen is you will get more time for yourself, because lot of time is wasted in transportation in metros. Every day you waste at least 1.5 hour to 3 hours in traveling only, in your
Correct.
cars only. That is a big. That is not a problem in tier 2 cities,
Correct.
and it's easier tier 2 cities. But the lifestyle you get, the actually education for your children, all those are not at par with metros.
Mm,
You
mm, mm,
have to think about that before moving,
mm.
because somebody is very used to outgoing for this mall, and all these systems are not still not available in tier 2 cities.
Correct.
So
Correct. Correct.
you should know where you want to live. It's not
Correct.
all about money. You have to decide where I want to stay, and then you can decide upon all other opportunities you have. Because
Yes.
I've seen many people moving back from tier 2 city to tier 1 city, or again to metro cities, just because they are not able to cope up with the environment over there.
Mm,
So it's a personal choices.
mm, 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 mm. Correct. Obviously, this is a personal choice, but yes, definitely a person moving to any place needs to understand about the lifestyle that is going to come up. But what about the monetary gains? What do you think is a better place for a good monetary gain as a doctor, practicing doctor?
Initially, in initial years, you will
Hmm.
always get a good income in tier 2 cities as compared to metro cities. That is,
Okay.
you should always.
Okay. Okay.
Now
Okay.
it all depends on your caliber.
Hmm.
In tier 2 city, you can become number one even after were practicing over there, because
Hmm.
there will be three or four people of your specialty over there.
Hmm.
If
Hmm.
you are super specialist, there will not be many people. Specialization, you may get 10, 12 people. But in metro cities, struggle is a bit more.
Hmm.
You have to understand you are just 34, 35, but there are people who are 55, 56. You have to compete with them, and you have to work under them.
Hmm.
Okay, unless you are a boss, you are not going to get very good income from corporates. In the corporates,
Correct.
it's almost a rule that a person who is heading the unit is having a hefty income, all others are subordinates. So you will never get a good income. Salary will
Correct.
be less. But it's all personal choices what you want in life. If you want a metro lifestyle, don't no, don't go to tier 2 cities. You will not like them.
Hmm. 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 That's true. So now, as discussed about different kind of job opportunities in depth. So you also mentioned about super specializations, fellowships. What is your opinion of people, doing multiple fellowships and multiple super specializations? What is your opinion around that? Should a person get established early? Because it's sometimes it's said the earlier you settle down, you settle down your practice in a better way, and so you have your patient flow. But or do you think that a person should go for specializations as their interest and then settle down? What is your opinion around it?
Actually, if you want to do a specialization, super specialization, it will be on one field only.
Correct.
But if you're going
Correct.
for a fellowship, you can't do a fellowship of everything.
Hmm. Hmm.
You have to decide that I have to do this and this thing. So one
Yes.
or two fellowships are more than enough. Let us suppose I take 10 fellowships. What's the benefit of
Does
that?
not make sense. Yes.
It will take 5 years and I will forget what I have learned. So
Hmm.
it's better whatever you are specialization you want to do in a one or two field. You can't be good in every field.
Hmm.
You have
Hmm.
to understand this. You can't be good in every each and everything.
Hmm.
You have to
Hmm.
choose that I'm going to be good in this, and you have to choose wisely.
Okay. 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 And cool about that. So now, if a person, if you can give a bit insight on what are the other kind of alternative job opportunities for doctors who want to, for doctors who do not outside the medicine field, as you just mentioned, going for IAS or MBA, what are the kind of alternative job opportunities for them?
Job, many job opportunities are there. First, they can change their field. They
Correct.
can MBAs, they can do. They can go in administrative services. They can
Mm,
any day can go in them. But another pharma industry is there which is doing research, so they can enter that. They
mm,
also need people to know how these drugs will work, and they for seminar purposes and all those things. They still need doctors. You
mm,
can then another way is insurance companies need doctors.
mm,
These insurance companies are there which need doctors. Another important field is hospital administrative services.
mm,
Somebody has to run the hospital. There are master degrees in hospital administration,
mm.
and doctors are preferred over there. So all these are the other opportunities which one can look for.
Okay. Okay. Great. It's nice to understand about each kind of job opportunities as well as some alternative career options also for doctors. So now, in the end, we want to understand any motivational quote, want to know any motivational quote from your end that has motivated you in your journey and will also motivate the medical students who are listening to you. Something from your end.
Things everyday talks with your friends motivates you. Nothing else motivates you. But you should be very clear that I have to practice in this field and I will try for this. If somebody gives you a work which you don't want to do, you will never find that interesting. You will feel every day you will curse yourself why I have chosen this branch.
Correct.
Be very specific. Whatever you want to do, you choose your branch. It doesn't matter. It will take some time, but choose your branch, and you should decide.
Correct. Correct. That's true. The most important thing is to choose the branch that you want to work for. That's really important and really nice to hear it from you, because these are some very basic points that you just miss out, but actually listening to people who are so experienced like you, it helps to imbibe that points. Thank you so much for discussing this thing with us, the kind of job opportunities, what are the key points that a doctor needs to keep in mind while going for post graduation, as well as the different kind of job opportunities for graduates and postgraduates. Thank you so much, sir, for discussing this with us. It's really nice to hear all of this from you. Thank you so much, everyone, for being with us to in this amazing session. And do share it with your friends and colleagues. I'm sure it will be helpful for them also to understand what are the important points before going for jobs after your undergrad graduation as well as your post graduation. Some points that will help them to look forward for a good future for them. Thank you so much, everyone. Thank you so much, doctor. Do follow us on our Instagram as well as YouTube channel. You can find all our old videos there that can also help you with your career growth. Thank you so much, everyone. It's really nice to have you here today. Thank you, sir, for guiding us with this insightful session. Thank you. Bye
Thank
bye,
you.
everyone.